Hi everyone, so we are learning about obstructed labor. Obstructed labor is said when the labor is obstructed, first of all we should know what are the things needed for a normal labor. So we know that passage, power. So what is the power actually? The uterine contraction. So uterine contraction should be high. Adequate uterine contraction is needed, and then the passage, that is pelvis. So pelvis should be big enough, or the diameter should be enough so that the baby can go through, and also the baby. So when the labor is obstructed, in that case the pelvis will be small or the baby will be big. So the uterine contraction will be there, good uterine contraction. You can see uterine contraction is appropriate. So you cannot say that obstructed labor is because of decreased uterine contraction, because there is good uterine contraction. Still what happened? The arrest of progress, that means the baby descent is arrested. It can be because of some mechanical factors. So the factors can be related to maternal cause, or it can be related to the fetus. So related to the maternal means it is related to the pelvis. So the pelvis can be small pelvis. So it can be because of some contracted pelvis, or there may be some kind of a tumor like fibroid. Now here you can see the tumor that is obstructing the passage of baby. Now the fetal causes. So the fetus, either the fetus may be big, so that is macrosomia, or some parts of the fetus may be big, hydrocephalus, fetal ascites, or fetus is having some abdominal tumor or conjoined twin. So it can be fetal anomaly. So in case of a multiple pregnancy also, especially when there is conjoined twins, that means both they come together. Now let us see other cause. Fetal cause can be like malpresentation and malposition. So malpresentation means other than vertex presentation, it can be either the shoulder presentation or brow presentation, like that. In malposition, though it is a cephalic presentation, it's not vertex. So in malpresentation means the presentation is other than cephalic. Here it is cephalic but other than the vertex. So it can be occipito-posterior or deep transverse arrest. Here you can see the normal baby with a vertex presentation, and here you can see it is. So you can imagine this is the right occipito-posterior. Okay. So occipito-posterior position. Now this is the longitudinal lie. So any other lie of the baby, we have said this is all malposition or malpresentation. Malpresentation. Okay. The normal presentation is cephalic. So this is malpresentation. This picture is showing about malposition. Next, how the uterus is behaving in case of this obstructed labor. So if it is a primigravida, initially they will uterus is trying to contract, but later uterus understand that there is some obstruction, later the contraction decrease. That's a state of inertia. But in case of a multigravida, uterus contraction will overcome is becoming more contractions will be there to overcome that obstruction. So what happens? The upper segment is contracting and contracting. You can see thicker and thicker, and the lower segment is weaker and weaker. So there is a kind of a junction in between, represented by a depression that is called Bandel's ring. So Bandel's ring is not normal, it is pathological retraction ring. You can see this picture. So normally abdomen should be like this, but here it is like this. That's why this is abnormal. Now let us see what are the clinical features. So in case of an obstruction, contraction will be more strong to overcome the obstruction so that membrane can rupture, or a Bandel's ring will be there. So how can you understand that? The mother will be anxious, exhausted. So these are actually the general findings that you can get when the mom is lying like this. So the mother will have tachycardia, tachypnea, fever, acidosis, and also will be dehydrated, exhausted. So when you examine the abdomen, due to the tonic contraction, it will be very difficult to palpate the fetal parts. You can see the Bandel's ring, and also in the abdominal examination you find that the baby will be on malpresentation or transverse lie. We know that is actually a risk factor for obstruction of labor. Now you can see the vaginal examination. What you can see, the vagina will be hot, dry, can be discharged, cervix may be hanging loose, the presenting part may be usually jammed in the pelvis. So this is the mom. When you examine the vagina, you can see that what are the condition of vagina, cervix. So vagina is hot, dry, maybe there is offensive discharge, and cervix may felt hanging loose. In cephalic presentation, there may be a large caput. So in case of a shoulder presentation, you can see there may be hand prolapse. Next, what are the complications? So it is dangerous to mother and the baby. What happens to the mother? There will be dehydration, as we have told all those things, acidosis, and may need to go for a CS, or may need an instrumental delivery, may also cause some tear, that is perineal trauma, or it can rupture the uterus, or it can rupture the membrane, chorioamnitis can occur, and late they can cause vesicovaginal fistula by injuring the bladder, can injure the nerve, pelvic floor relaxation may occur. So the complication that can happen to baby is asphyxia, and later baby may die because of the rupture of placenta. So how can you manage this? Proper antenatal care and partogram you have to monitor. So this is to prevent. While if it has already occurred, how can you manage? Then you have to correct everything. So you know that the mom has gone to hypotension, so you have to correct it by giving fluid. You have to correct the fluid loss either by giving dextrose or ringer lactate, or you have to give blood transfusion, and you stop giving oxytocin. No more oxytocin is required because we are taking the to the CS, or either instrumental delivery can. So antibiotics can be started. Obstetric management is, if the fetus is alive, suppose if the fetus is alive, then you have to do the CS. Even though if fetus is dead, there are no signs of impending rupture, destructive operation are an option. So CS should be performed by an experienced such that there is no chance of injury to the bladder. You have to exclude that, or you have to make sure there is no uterine rupture. So all these are important regarding obstructed labor.